Hi, I'm Wendy Alderman, a Senior Risk Management Consultant at ProAssurance. Workarounds, or deviations from the standard process, occur frequently within healthcare. They're informal, temporary workflows to accomplish a task when the ordinary workflow is not functioning as expected. Many times, physicians are attempting to accomplish a task that needs to be done for a patient, but the ideal method to perform the task does not work because it has a process flaw that prevents completion of the task, or it's not applicable under the current circumstances. Workarounds allow continued delivery of care with minimum disruption to the patient or provider. Physicians may have long-standing methods of delivering care that are unknown to others within the same health system. These alternative care deliveries may appear to function adequately until an adverse event occurs or a patient experiences a near miss. An example of a clinical workaround is when healthcare professionals copy forward patient treatment notes without editing their content. Copying and pasting often occur when the EHR does not provide useful or relevant data for the patient encounter. Copying part of the medical record may be more efficient than typing an original note, but it also risks propagating outdated information in the patient's medical record. Other physicians and clinicians may fail to realize that patients' notes do not contain accurate information. The copied information may contain health details that are no longer relevant to the patient's care, or worse, may contain false information. The integrity of patient health information should be paramount. Many physicians do not consider the risk of using workarounds to accomplish patient care tasks. Alternative or less than ideal workflows can compromise the execution of patient care. Workarounds can lead to poor documentation and can contribute to misdiagnosis, patient injury, failure to treat, or possible medication errors. Substandard documentation is a leading contributor to adverse patient events and a driver of professional liability lawsuits. Physicians should aim for accurate and complete documentation when using a workaround, such as copy forward. Physicians are challenged by poorly performing systems and tenaciously work to overcome operational failures. Workarounds are an inevitable part of the job. Operational processes can make it difficult for physicians and clinical staff to effectively carry out patient care. Circumventing workflows can be unsafe. When developing or changing processes, enlist frontline staff for feedback to ensure against unintended consequences. We hope that by considering workaround risk, physicians can reduce potential dangers to patients when using these alternative methods to care delivery.